Jail was just a school for criminals.
Treatment's a lot less expensive.
It's hard to tell someone in active addiction that there's a way out.
We've had to really elevate our game.
Very hard to treat opioid addictions.
In 2016, we lost 64,000 Americans to drug overdoses, 174 deaths per day, 7 per hour.
In Florida, 5,725 opioid-related deaths were reported in 2016, a 35% increase from the prior year.
It's definitely gotten worse. There's more people dying here than I've ever seen before. And I've been watching people die my whole life, since I started getting high.
I've done probably all of my life about 2 years or so, in and out.
Well, I started going to jail when I was 14, and I've done probably close to 3 years in different county jails.
Judge John Burns is the presiding judge over Charlotte County Drug Court, the program Lauren was brought into last April to help detox off opioids and other substances.
Our program has a maximum allotted spaces of 30 people.
Those spaces are constantly being filled. And Judge Burns says nationally, drug courts usually only have a 33 to 45% success rate.
The, cure rate or success rate of opioid treatment nationwide runs around 10%. It's very low, very hard to treat opioid addictions.
Down in Collier County, Judge Janice Martin has also seen a rise in opioid users coming through drug court over the years.
And one of the things that really sticks out has been the shift in terms of drugs of choice and really the demographics that we're serving. We've had to really elevate our game to address folks who are younger and much more deeply addicted than just even 10 years ago.
Unfortunately, a lot of people don't live long enough to make it here.
Research shows that the relapse rates for addiction are similar to relapse rates from other chronic conditions like cancer and diabetes, so it's similar.
Maggie works at the David Lawrence Center, a treatment facility that helps nearly 9,000 people a year for mental health and substance abuse.
I seen a friend of mine overdose, and that's something that's been burned into my memory. So to see somebody blue and dying, and I felt like I had a part in it. I was giving them drugs, and I felt like I had a part in that. I got this I don't know, maybe 6 or 7 years ago. And I got it because it was something that was related to the lifestyle I was living. And that's a devil or a demon holding a needle in his other hands holding a guy on a puppet string. I had a moment of clarity when they called me and asked me if I wanted to do drug court, because I thought I was going back to prison.
And I know what you might be thinking. Why should my tax dollars go towards criminals with an addiction? Well, it's different than you might think.
These folks are paying their own way. We know that incarcerating these folks not only sucks up the tax dollars, but it does very little, if not nothing, to actually make them better.
Treatment's a lot less expensive than these other avenues where traditionally people with addiction end up. The legal system, in the hospitals, in and out of hospitals, that is much more costly to the community than treatment.
To put in perspective, for every $1 taxpayer dollar that goes towards drug court, you're saving $2.33 more. That would go towards the justice system and incarceration. That's because drug court participants have to help pay their way through the program.
Why do you think jail does not help?
Because you can't scare a drug addict. You can't scare a drug addict. You can't threaten them with jail. You can't threaten them with death. You can't threaten them with the loss of their kids or their family. It doesn't work. Jail was just a school for criminals. I came out of there probably worse than I was before.
Our biggest fear is the funding, is just making sure that the state of Florida, that the legislators understand that we need them. We need the funding because we want to help people succeed.
And while the problem is getting worse, it's also getting more media attention.
The opioid crisis continues to affect the nation.
Combat the opioid epidemic.
Major problem in our country, opioids.
And the spotlight hasn't been a bad thing. More organizations are getting involved in prevention and treatment.
We give out Narcan kits for free. Anyone in the community can come to David Lawrence Center and get a Narcan kit.
when I was sitting in jail on my charges that got me into this program. I realized I had a problem. I'm glad that happened because it got me into this program, believe it or not.
It's by the grace of God, I think, that that happened. The way that things fell in my recovery, and when I see people that I used to party with, it's a reminder. I was like, oh, I remember in the beginning when I recovered, I was like, oh my God, I used to look like that. Wow. And then I went back and looked at some pictures of myself, of what I used to look like, and I looked like death. I looked like I had a terminal disease.
Is there really any way to help them unless they can help themselves?
Not really, honestly. I mean, not in my experience.
It's hard to tell someone in active addiction that there's a way out. I was on drugs for so long, that was my sober. When I finally got off drugs, it was like almost being on a new drug. Everything was incredible and fascinating. It was like I was seeing things in a new light for the first time. I kind of went back to the things I enjoyed when I was younger before I really, got into the drugs heavily. I focused more on my art and just everyday life. Never. And I know if I can be fixed and saved, anybody can.